Hi friends, so today we're going to talk about eye drops. So this is inspired from one of my patients. In the spring, her eyes are bloodshot, red, she's itching, she is miserable. And so for her, we prescribed some anti-allergic eye drops, ketotifen and olopatadine. And she was like, doctor, it's helping, but I'm not sure if I'm doing it right because as soon as I shut my eyes, all the eye drop is out. So I don't even know if I'm getting any eye drop. So, how do we know if we're getting eye drops and how do we actually use eye drops correctly? Okay, eye drops are not only given for allergic conjunctivitis, they have many other indications such as bacterial or viral infection, glaucoma, dry eyes. So, and the use is pretty much the same for all of them. Okay, so let's go deep into it. Eye drops are basically liquids that you instill on your eyes. How they are absorbed is the small capillaries that you see. The outer part of the eye doesn't really have a vessel supplying it. It's like small capillaries and they absorb the eye drop. And it acts mostly locally, although like around 1% of the eye drop can even be absorbed systemically. So that medication can have effect on your body, but for the most part, it's on your eyes locally. Okay, how to use the eye drops. So firstly, take your eye drops. If it's something that stings you, it's not a bad idea to actually put it in the fridge and then remove it from the fridge when it's cold, and cold eye drops usually sting less. Okay, before you open it, shake it 20 times. A lot of eye drops are lipophilic and the pH and everything matters, and you really need to shake it before you use it. Not all eye drops, but it's just a good practice to shake it 20 times before you use it. The third thing is it's very important to keep your eye drops clean. So wash your hands before you open the cap. If the cap falls down, make sure you sanitize it. Make sure that the nozzle of the eye drop doesn't touch anywhere, because that's the easiest way of getting infection to your eye. Okay, so once you're done with all these steps, open the cap, and then the best place to put it is in this cul-de-sac. Like, you know, if you get your eye like this and then put it here like this, usually you are the best person to put your own eye drop because you have muscle proprioception, so what we call muscle sensation. You know where your skin is, you know where your arm is, and you know where your other hand is. For someone else, it's a little more difficult to put eye drops for you. So if you can, I know it's very hard to put anything in your eye. It's hard to even touch your eye, but that's how you will get the most precise, like that one drop exactly in the spot where you want it without it overflowing. But if you trust someone else, that's also okay. But make sure whoever's putting the eye drop washes their hands. So the tear film, the tear that we have is actually very small in volume. It's like 10 microliters, and it can expand up to 30 microliters if you really want to cry or anything. But an eye drop is like 40 to 70 microliters. So that's a very large amount of volume for that little space. So lo and behold, some is going to come out. And what we target is even 5% absorption gives us the clinical effect of the eye drop. So even if 5% is absorbed, it's okay. If you put it in the cul-de-sac, usually you won't see a lot of overflowing. The other thing you can do to increase the absorption is pinch your nasolacrimal duct. So the nose and the tears are connected. So your tears actually drain into your nose. So you don't want the tears to drain into your nose just after you put the eye drop. So you see those two holes right next to your eye. Just put your thumb and index finger right there just after you put the eye drop, and it will stop the flow from your eyes to your nose, and that will increase the amount of eye drop that is available. The third thing you can do is close your eye for 5 minutes after putting each eye drop. So right eye drop, close your eye. Left eye drop, close your eye for 5 minutes. Between two eye drops, maintain a time gap of at least 10 minutes because the absorption is very local. It's to the capillaries. You don't want two medications to interact. Always check the expiry and don't use expired eye drops for your eyes. If you have any questions or if you want to learn more about other topics, please feel free to leave it in the comment box. And happy eye drops!